All right, today we are going to go over Unit 6, which is our tracheostomy care and suctioning. Today we will, wants us to confirm or provide our orders. We're going to do our skill overriders, our K-wipes, and identify with 2 identifiers. You can confirm your orders and identify your patient at the same time as you go into the patient's room. Stand check at 6842 and stand agrees. We've provided privacy, we've washed our hands. Stand today, we're going to provide some trach care, we're going to do some trach suctioning. Now we want to assess the oxygenation of the patient. We can do this a couple different ways. We're going to look is stand in respiratory distress. How many breaths per minute are we breathing? Are we breathing too fast? We have our pulse oximeter we're going to put on, and we notice that Stan is now at 85%. We can use our stethoscope to listen to Stan's lungs, listen to the lung fields, and we hear a lot of coarse breathing sounds. At this time, we know that the patient is going to need some suctioning to get that cleared up. I want to put on my clean gloves. I want to make sure that Stan's in a semi-Fowler position. This is 45 degrees. We don't want Stan lying flat as we're suctioning the patient. One of the other things I like to suggest whenever we're getting into the suctioning is let's go ahead and take out that pillow to help them lay back flat and make sure that we have enough space. Our orders here say that we're going to put our oxygen on. We want to make sure that we get this ready before we even think about putting on sterile gloves. I got my oxygen on. My orders say I want it at 5 to 8 liters. I turn that on for 6 liters. I also want to turn on my suctioning. I will turn this on. When we turn on our suctioning, we want to make sure that we turn it on to continuous suctioning and not intermittent. We turn that on. We want it no more than 150. And we get our suction tubing ready. I'm going to go ahead and lay my suction tubing in the bed. And the patient, our oxygen's on the patient. We'll move on. Here we can start getting into our trach suctioning kit. I will put on my PPE. We'll put that in the patient's lap. You'll notice it's not on your sheet, and that's because the sheet has been altered a little bit, but you want to make sure that you put your PPE on. I'm going to take off my gloves, and I'll wash my hands. Because I'm putting on sterile gloves, I will take off my watch. This is my trach care kit, and I'm going to open it. We want to make sure we have our saline here. I'm going to open it, making sure as I open it, I'm opening it to the side. We don't want to reach over our kit here. When you open that kit, just go ahead and rip this off, toss it over. I'm going to put on my sterile gloves. I'm going to finish this out here. A lot of students I want to go ahead and I want to open this up. I'm going to pour some saline into my kit here, and I want to put this at the end of the table. A lot of students, you got to be careful when we open our sterile gloves that we're not opening this and putting it over our sterile kit. If you have trouble, just come to the end of the table here. I will making sure that our packaging doesn't come back over. Making sure that we grab our first sterile glove by the cuff here. And I'm going to slide that on. end, I'm going to put this on too. Now, I don't need this. My hands are sterile. I have my saline in here. I have my patient oxygenating. I can see my thing. And remember, we got to be careful. And the reason that we put this stuff in the bed before we do anything else is I don't want to have my sterile gloves on and think that I need to reach here, because one, these are sterile hands, and I don't want to risk turning my back on patient. You can put your kit over your patient as close as you want. Now, I want to pick up my thing. I want to get this at the end of my hand here. And now I'm ready to get this hand dirty because there's really nothing else I can do with it. I'm going to put this here. The first thing I want to do is practice suctioning. I got my saline here, I'm just suctioning to make sure it's getting into my canister. It does. Now these are the parts we want to be careful. This tube is considered sterile here. You don't want to touch the table. As you're going in, you don't want it down here. If I'm coming in to do my suction pass, I'm going to be careful here. You better than me. We'll put this rail down, but don't come here. Make sure if you frayed your name badge, we'll get in the way. We'll toss it in our pockets. But again, so I've tested it, and I'm going to put that on. Now, we're oxygenating. I'm going to make my first pass. I'm holding up here. That way it's not anywhere too close to my scrubs. I'm going to hold up here. I'm going to go for my first pass. I hold my tube. I kind of pull it up here because, again, if you let too much slack in here, you're risking hitting this. And the reason we pull the pillow out is because I want to open up this space as much as I can. I've got my tubing up here. I'm being very careful because I want very much control of this. I'm going to stick this in and just feed this in until we meet resistance or the patient starts to cough plenty. And at this point in time, I'm going to suction using a spiral movement. Remember, we do not suction on the way in, but I'm suctioning on the way out using a spiral movement, no more than 20 seconds. And it's stuck, but yours won't be stuck. Suctioning, suctioning, and then I'm going to hold this up here, putting this over, and I'm going to suction and clean out my catheter. We're going to oxygenate 30 to 60 seconds. If you read on your sheet, it says that we're going to repeat suctioning, process again, alternate nostrils if not contraindicated. That's because prior to this it was nasal pharyngeal suctioning, but they took that out. And again, our kid is above our waist. I'm keeping it in my view. I am going to, again with my dirty hand, pull this off. I've suctioned to clean it. I'm going in for my second pass, not suctioning on the way in. And then I'm going to suction on the way out using the spiral motion. Being careful as the catheter comes out, don't let it flick. Just make sure you maintain control of this on the way out as well. Pull, pull, pull. And then I'm going to release the suctioning. Again, replacing the oxygen with my dirty hand, clean out my tubing. We're going 30 to 60 seconds, and we're going to go for our third and final pass using that. Again, not suctioning on the way in, which means I'm not covering it up with my thumb. Meet resistance. I'm going to start suctioning, twisting motion, and making sure I have contact of that. And again, that's my third pass. I can't do more than the 3 passes. I'm going to toss my kit to the side there. I'm going to remove my gloves. I'm going to leave these on though because we'll go over another part. Now we're going to reassess Stan's. What's his respiratory rate? What's his effort? Is he breathing better than he was? Yes. His oxygen's now up to 97%. I'm going to listen to our lung sounds. Those are clear. Now we've seen an actual improvement in Stan's work of breathing and oxygen status. We remain sterile, again, making sure that we don't touch anything dirty with our dirty hand, that we're not turning, again, we come here with our sterile kit, so it's not, I don't want to, because here it's very hard to turn my back on that kit if it's right in Stan's lap. Making sure that our stuff over here is prepared before we even start. And making sure, again, you're not touching anything with the tip of the thing. Making sure hair's out of the way, badges out of the way, jackets, or whatever. Now we're going to assess the need for providing tracheostomy care. Okay, it looks dirty, looks like it needs a change, and we're going to do our second part. We want our trach kit. This is in the garbage. This one is, we're going to open this up, again using the same technique. Don't reaching over. I'm going to open to the side. I'm just going to go ahead and toss this. You got your sterile gloves on. Technically at this point we will let you put on the second set of sterile gloves, but I'm going to cut that out for this here. I want to use this to, we're going to pick up the oxygen because it's only as needed. Pour in to my little compartment here, and I'm going to, at this point, I'm going to put on my sterile gloves, and now I can look through my field. You can grab this because both your hands are sterile. We can lay this on the patient if you want to. Looking through, you can damp some of this with your stuff. Now, I want to unlash the thing. They pinch from the side. Try to twist as you're coming out. And we're going to make sure that we're not touching our hands on this. With my hand here, I'm going to drop this in, and I'm going to pick it up. And this is wet already, and I'm going to start cleaning it with my thing, cleaning the outer cannula, anything that you want to use to clean it off. Toss this to the side. These are wet. We'll clean those off around the edges. Whatever dirty needs to be done, and you can dab dry on these sterile gauze. And we will replace, making sure that we're going to try to come from the side here and it twists as it comes in. You will hear it click. They just pinch to open, hyperventilate if needed. Basically what it really means to say is hyperoxygenate if needed. And we move on to our disposable one. Pretty easy, it doesn't require the sterile gloves. We're going to open our kit. And again, I'm not grabbing the inner cannula. You want to grab the outer thing here. I'm going to take this one off, throw it away, put in my new clean one. And again, going from the side there. Now, we want to get rid of this. We're going to clean around the side here. We can take off our old gauze, and we're going to use our cotton swabs, and we're going to get in behind this plate here and go from the inside to the out, clean to dirty, and we're only going to make one swipe with each of these little thing. And you can use these as well, but using both Q-tips to kind of dip and then clean at the bottom, again going from the inside out. It's a little hard to get on the mannequins because they're rubber. Now I want to replace my split gauze. It's not going to be perfect. And do that. We want, make sure that you pat the skin dry after you clean it. Now we're going to change out the holder. This little thing here. I like to, you'll have the other nurse, another nurse will come hold this for you, but the way that I do this is I'm going to take off this one as my other nurse is helping. I'm going to attach this to the clean collar. I will have this one on Velcro as the nurse, again, continuously holding. When you pull this off, you'll pull this through, disconnecting this, and feeding it through. Making sure that you can put 2 fingers underneath it. At this time, I'm going to take off my PPE and perform a hand hygiene, taking off my gloves. I'm going to assist them to a comfortable position, making sure our bed's in lowest position. Again, checking our oxygenation, and we're going to discard all our supplies. And at the end, I will document, and that is your trach care.